Now, as it relates to shift a little bit to the question of public racism as a public health issue, you are right. The county has done a lot of work, both in the public health space and on the legislative space, in terms of looking at racial equity as a social justice issue. Within the public health space, we have prioritized using data to tell a different story. And so we've put out a number of reports that talk about race, talk about geography, talk about gender, talk about health disparities and inequities across the county to help our elected officials and policymakers to help advise that process. So that will continue to be a priority. We have also utilized an approach of health in all policies, which really targets looking at social determinants of health and the impact that they have on health outcomes. And we've provided education to all of the departments across county government to help them understand the impact of their related decisions and their policy areas on health outcomes. Now, one of the other things that we're doing right now is pulling all of those old toolbox issues or tools in our toolbox to be able to highlight those areas where we've seen the most cases. So our epidemiology team has identified the zip codes where we've seen the most cases and are looking across. So not only what do those zip codes look like as it relates to COVID-related illnesses and deaths, but we had a previous report looking at zip codes about a year and a half ago. So what do those zip codes look like in terms of education, socioeconomic status, health outcomes, access to care, and chronic disease burden? And what we have found is that many of those same zip codes don't score as high on good health outcomes. And so as a result, we are working with everyone from our chief equity officer to county council to the executive branch to develop strategies that are not only addressing the short-term issue in terms of COVID-19, so making sure we have enhanced testing, very specific partnering with agencies within those zip codes to do more effective, robust contact tracing, but also thinking about what are the long-term systemic strategies that need to be put into place to improve the overall health outcomes of those communities so that they are not predisposed to having adverse outcomes or more COVID-related outcomes if this happens in the future.